Good morning, everyone. We are going to study about interceptive orthodontics today. I'm going to share this slides on interceptive orthodontics. So, what is interceptive orthodontics? It is defined as that phase of the science and art of orthodontics employed to recognize and eliminate potential irregularity and malfunction of the developing dento-facial complex. The procedures undertaken in interceptive orthodontics. These are serial extraction, correction of developing frostbite, control of abnormal habits, space regaining, muscle exercises, intersection of skeletal malformation, removal of soft tissue or bony barrier, enable eruption of teeth. Now we are going to see about serial extraction. These are planned and sequential removal of the primary and permanent teeth, intercept and reduce dental crowding problems. This definition is given by Tree. The term serial extraction was given by Gelgren in the year 1929 and it was popularized by Nance in the year 1940. Indications are arch-length tooth-side discrepancy with one of the following: absence of physiologic spacing, ectopically erupted teeth, mesial migration of buccal segment, skeletal plasma malocclusion, straight profile, and when growth is not enough, overcome discrepancy. Now, we are seeing the indications. These are arch-length and the contraindications are space deletion, class 2, class 3 essential malocclusion, anodontia or oligodontia, open bite or deep bite cases, mild arch length discrepancy. So these five are the contraindications to serial extraction. In all these five cases, you shouldn't do serial extraction. In arch-length tooth material discrepancy and physiological tooth movement, it should be taken into consideration. The three types of serial extraction methods are Duell's method, which follows the pattern of CD4, Sweet's method, which follows the pattern of D4C, Nance method, which is also D4C. So, what is the procedure involved in Duell's method? In the first step, we have to extract deciduous canine to create space for alignment of incisors. In the second step, extraction of deciduous first molars are done, followed by the third step, which involves the extraction of first premolars to permit permanent canines to erupt. So these are the three steps involved in Duell's method. As you can see, it follows the pattern of CD4. These are the four diagrams which depicts a CD4 extraction pattern. This could be easily understood by the red dots, which tooth is extracted first, followed by which one. Now we are going to Sweet's method, the second method, which is the Sweet's method. This involves the extraction of deciduous first molar by the extraction of first premolars and deciduous canine. So in the diagram A and B, you can see that the first molars, primary first molars are extracted first, and then first premolars and deciduous canines are. Now, we are going to learn more about the definition of frostbite, an abnormal relationship of one or more teeth to one or more teeth of the opposing arch in the buccolingual, labiolingual direction. So, this is the type of Frostbite, which has been corrected, you can see. So what is the classification of frostbite? Frostbite can be classified into anterior or posterior frostbite, buccal or lingual frostbite, a dental or skeletal functional frostbite in etiology. Situations in which posteriors overlap vertically in habitual occlusion with their antagonists without contact of their occlusal surface. The deviation of the affected teeth from their ideal position could occur either in a buccal direction or in a lingual direction. So dental frostbite, an abnormal relationship between antagonist teeth that is due to any deviation in the position or inclination of one teeth. The relationship between the maxilla and mandible harmonious. Such frostbites are treated by tooth movement. So the treatment is fairly simple. We can correct this frostbite by tooth movement alone. In this picture, you could see a dental frostbite. This one involves a dental frostbite with two teeth. In here, it is only one teeth that is in frostbite, whereas in here, two teeth together are in frostbite with the lower two teeth. Now we are going to study about skeletal frostbite. It can be anterior or posterior, either unilateral or bilateral frostbite that is due to a sagittal and transverse inflammation in the side or shape of the maxilla mandible. Treatment usually requires a skeletal expansion by means of rapid maxillary expansion or orthodontic surgery. You could see that here it is a skeletal plating frostbite. So as you could see, this frostbite is due to the sagittal or transverse incoordination or incoordination in the size or shape of the maxilla mandible. Here, the best treatment would be expansion of the concern. So this is also a skeletal frostbite. Now we come to functional frostbite or pseudo frostbite. So what is functional frostbite or pseudo frostbite? A frostbite that is due to a stiff mandible in the faulty habitual occlusion because of premature occlusal interference is known as pseudo frostbite. The shift may occur in an anterior direction or lateral direction. See here, this is a pseudo frostbite. This is a functional bite shift. See, as the person is trying to close his mouth, we could see that there is a clear functional shift. So how do we correct these cross? We could use tongue blade therapy, incline plane, composite incline, Hawley's applied with effect spray, and cord helmet. So which one in the habits must be intercepted? Thumb sucking, tongue thrusting, mouth breathing. So what is a habit? A habit in the orthodontic sense refers to certain actions involving the teeth and other oral or perioral structures. These are repeated often enough by some patients to have profound and deleterious effects on position of teeth and occlusion. Habits that can affect the oral structures are thumb sucking, tongue thrusting, mouth breathing, so. Presence of the habit up to 2.5 to 3 years is considered as normal. Beyond 3.5 to 4 years of age can have a damaging influence on the genitoalveolar structure. So, what is tongue thrust? It is defined as a condition in which the tongue makes contact with any teeth anterior to the molar during swallowing. Presence is often by an anterior perforation most, and it can be intercepted by using hard paper. The patient must be trained and educated on correct technique of swallowing. So, it can be obstructive or habitual in nature. Nasal obstruction such as nasal polyp, nasal tumor, chronic nasal inflammatory condition, and due to a deviated nasal flow. Persistence of oral breathing, habitual oral breathing is an indication to use the vestibular screen to index a habit. So mouth breathing can be due to all these conditions. So which one exercise can be done? Exercise for masseter muscle, exercise for circummoral muscle, and exercise for chest. So exercise for the masseter muscle is to strengthen the masseter muscle, clenching of teeth by the patient while counting to 10. Repeat the exercise for some more duration of time. And exercise for circummoral musculature can also be done. That is, upper lip is stretched in the posterior-inferior direction by overlapping the lower lip. Muscular lips and such exercises allow the hypotonic lips to form oral seal easily. Hypotonic lips can also be exercised by holding a piece of paper between the lips. Parent can stretch the lips of child in the posterior-inferior direction at regular intervals. Splashing of water between the lips until they get tired. Massaging of the lips. Use the wall screen with a holder to exercise the lips. Button pull exercise. Tug of war exercise. So what are the exercises of the tongue? Can be one elastic swallow, two elastic swallow, tongue hold exercise, or hold full exercise. So different types of epilepsy can also be given. Fixed appliance like herb space regain, jack screw space regain, Gerber space regain, removable appliances like Holly's appliance with helical spring, Holly's with split acrylic dumbbell spring, Holly's with slingshot elastics, Holly's with parallel spring, and Holly's with fixed spine. So thank you everyone. I've done a brief discussion on interceptive orthodontics today.